Hello, and welcome to today's webinar, The Power of PHMB in Infection Prevention, AMD Antimicrobial Dressing. This webinar is part of the Wound Source Wound Care Product Navigator Series. The Wound Care Product Navigator Series is an easy-to-access interactive learning lab for healthcare professionals to get the latest information they need on the wound care products available to them. Each webinar segment will take a deep dive into the specific product technology. Our sponsor for this installment is Cardinal Health. My name is Amy McCauley from Wound Source, and before we get started with today's webinar, I just want to go over a few details. This presentation will walk you through the importance of infection prevention throughout the course of treatment. More specifically, we will focus on the unique benefits of dressings impregnated with polyhexamethylene biguanide, or PHMB. This presentation will be followed by a question and answer session, so we encourage you to submit your questions to us throughout the program. As a reminder, the content of today's webinar is for informational purposes only. It is not intended to be a substitute for professional medical advice, diagnosis, or treatment, nor is it intended to be a substitute for manufacturer instructions. Always refer to your facility protocol in the assessment and treatment of patients. The views and opinions expressed in this program are solely those of the presenters and do not represent the views of Wound Source, Kestrel Health Information, Inc., its affiliates, or subsidiary companies. Now I want to take a moment and provide you with an overview of your webinar console. At the bottom of your console are application tools that you can use during the webinar. To submit a question to our guest speakers, please select the Q&A app icon on your screen and type your question in the field provided and select Submit. We will try to get to all of your questions during the question and answer period. You can expand your slide area by clicking on the Maximize icon on the top right of the slide area or by dragging the bottom right corner of the slide area. If you have any technical difficulty during the program, please click on the Help icon, which is the app with the question mark. This covers the most common technical issues. To access information about today's guest speakers, you may select and expand the Bio app found on the left-hand side of your console. Our sponsor has included additional information on today's product. On the right of your console, you will find a list of resources available for download. You may also access this information by selecting the document icon in the bottom tray of your console. This webinar is being recorded and will be made available on demand. If you have any other requests or questions pertaining to this program, please contact our sponsor using the Contact Us app located in the tray of your console, which is the application with the email icon. Now, before I introduce today's guest, please take a moment to complete our quick poll, which should display on your screen momentarily, to help us find out how many have joined us for today's session. The question is, how many people, in addition to yourself, are watching the webinar with you today? If you are attending this webinar by yourself, simply enter a 0. If you are in an in-service setting, an estimate is fine, and we thank you for your response. At this point, I would like to introduce our speakers. Maria Cotula is a Master's Prepared Certified Wound Ostomy Nurse, or CWON. You can see her full credentials on the screen. Maria is the Clinical Operations Manager of the Acute Wound Care and Specialty Nursing Team at Cardinal Health. Before coming to Cardinal, Maria worked at a large healthcare system in the Carolinas as both a cardiac nurse and a WOCN. Under that hospital system umbrella, she experienced a variety of settings as a WOCN, including their small, medium, and large Trauma 1 flagship facility, as well as an outpatient ostomy clinic.
Hi, everybody. Thanks so much. Glad to be here.
Next, we have Debbie Rao, a WCC nurse and certified lymphedema therapist holding a bachelor's degree in nursing. Debbie is a senior clinical consultant with the acute and specialty nursing team at Cardinal Health. Before joining Cardinal Health, she worked in various acute care settings, including SICU, hemodialysis, and long-term acute care as a staff nurse, case manager, wound care nurse, and chief nursing officer. She also owned and provided lymphedema care in a freestanding lymphedema clinic.
Good afternoon, and thank you.
In addition to our speakers, Jen D'Angelo from Marketing and Rich Gahan from R&D will be available during the Q&A session at the end. To start us off, Debbie will discuss the basics of PHMB, and then we'll dive deeper with use cases and examples.
Hello again. In my practice, I knew about AMD dressings and used them occasionally, but I didn't fully understand how it worked nor its benefits. And I hear this frequently from wound care nurses across the country. They are aware of AMD dressings, but not really sure where it fits or the benefits. The Cardinal Health AMD portfolio of antimicrobial dressings have many features and benefits to assist in preventing and combating infections, which I'm going to outline and hopefully pique your interest. These dressings are impregnated with PHMB, a bacteria-killing polymer. PHMB attaches to and lyses the cell wall, leaving nothing left to mutate or replicate. As you can see on this slide, the foam dressings are impregnated with 0.5% PHMB and all other products in the portfolio with 0.2%. AMD dressings are active, wet, or dry, and are effective up to 72 hours in gauze dressings and 7 days in foams. So now let's explore a few of the benefits of AMD dressings. First, PHMB is easy on the skin. No known allergies or sensitivities have been reported. It is not cytotoxic like some other antiseptics and is effective at lower concentrations than CHG or silver. Nurses share with me that they are looking for products to reduce the need for silver and that patients can tolerate well. AMD can be the answer. Second, it effectively kills bacteria but does not negatively impact epithelialization or slow the healing process, making it safe to use on most patients. PHMB kills a broad spectrum of bacteria, yeast, and fungi, and best of all, there is no known resistance. Third, they have an extended wear time and are very affordable to hospitals, home care, long-term care facilities, and patients, providing continuity of wound care. To review, dressings function to create a barrier to bacteria and other organisms that could enter the wound. The PHMB in the AMD dressing adds to that protection as it resists bacterial colonization and reduces bacterial penetration within the dressing. They can be used as a primary or secondary dressing, can be utilized for a wide variety of wounds, which Maria will discuss later. In addition, there are specialty products for tunnels to fit around tubes and trachs, and line insertion and exit sites. As we all know, facility-acquired infections are a huge concern, and in particular, surgical site infections are often referred to as SSIs. Did you know that PHMB has been proven to reduce not only SSI rates, but associated treatment cost as well? The same holds true outside the hospital, such as in the home or other care settings where SSIs occur. It is well documented in literature that close to 60% of all SSIs are diagnosed after discharge, most often within the first week. And many were found to have surgical site infection as their only post-op complication. In doing a literature search, studies reported that a range of 31 to 54% of all superficial SSIs diagnosed after discharge required readmission. We all know this is a main focus of CMS and what all facilities want to eliminate. Another area to consider is care after discharge. Patients and/or their caregivers often report feeling overwhelmed and fearful about self-care after discharge. We have all seen that deer in the headlight look during our discharge teaching. As nurses, we want to assure instructions are understood, allay any fears, and empower patients and or caregivers, making their transition a positive experience and as easy as possible. AMD dressings offer a win-win solution. They are easy to apply. They do not require daily dressing changes. They are effective in infection prevention and are very cost-effective. As I mentioned, Cardinal Health AMD dressings have been proven effective against a multitude of bacteria, yeast, and fungi. It is effective against both gram-positive and gram-negative bacteria. This list is not exhaustive because, remember, there is no known resistance to PHMB. AMD dressings have been on the market for several years, but in my opinion, as a wound care nurse, they have been underutilized, especially since they provide so many benefits and are inexpensive compared to many other wound care products. There are a wide variety of AMD products that you can have in your arsenal to help prevent, combat, and reduce infections in your patient population. In addition to hand hygiene, I believe being informed, proactive, and prepared are the greatest defenses against infection.
Thank you, Debbie. Next, Maria will discuss layers of protection and use cases for PHMB.
Yes, and Debbie, thanks. I always learn so much from you. Let me just start out by pointing out that our clinicians spend a lot of time in the field working with hospitals across the country, talking to nurses and wound care nurses, doctors and surgeons. And one of the common findings we often uncover is that many clinicians don't really understand the various uses of AMD and how they could use it to maximize healing and elevate quality patient care. Two common questions we hear over and over. Number one, what's the difference between AMD and silver? And number two, when should we use one over the other? I like to think of it as choosing the right dressing for the right patient at the right time. And think about that. Let the wound characteristics and risks determine your dressing choice, which is what we do as WOCNs all the time, right? A simple way to harness this concept is to think of tiers of protection that take you from standards of care to best practice. The first tier, that's your clean dressing, or if you're in the OR, a sterile dressing would be your standard of care. You take the dressing out of a sealed package, it's clean and dry, and you place it over a wound or in the wound to absorb, protect, and sometimes treat. Then the second tier, let's say you want to kick it up a notch. You might select a dressing such as Zeroform gauze. Zeroform is laced with bismuth tribromethanate, which makes it a bacteriostatic dressing. Let's discuss that for a second. Bacteriostatic simply means that the dressing is inhibiting bacterial growth. So it's not killing bacteria, but it's preventing new microbe development and replication, basically making the environment very uncomfortable for bacteria to grow and multiply. Then the third tier is your AMD with PHMB. I like to call this the sweet spot. PHMB does kill bacteria, but it kills bacteria in the dressing itself. That means when drainage or exudate cascades into the dressing, PHMB lyses the bacteria cells and pathogens in the dressing. Basically, if you think of a combat scene, little microbes on one side marching toward the AMD dressing on the other side, with PHMB as the front line of defense, well, that attack strategy of the AMD is to let the microbes come to them. Finally, the fourth tier is your silver dressings. They are the gold standard. They go into aggressive attack mode. Silver ions actually leave the dressing and seek out to kill and destroy bacteria. I like to picture silver ions like knights on horses, going after infection with a mission and a spear that can kill bacteria in the wound bed. In this scenario, I really believe that AMD is, again, the sweet spot. Using it early on so maybe we can prevent having to reach out for silver at all. We should call out the elephant in the room anytime we're talking about silver. Everyone knows it's so darn expensive. And actually, many clinicians don't even reach for silver these days unless they clearly see those signs and symptoms of infection. We're talking about erythema, edema, pain, foul odor, purulent drainage, and now not only because of cost, but also because silver is so potent and has shown to cause various adverse reactions. I'm really passionate that the answer to this conundrum is to better educate clinicians on the when and why to use AMD. So let's talk about that for a minute. Here are some specific suggestions and examples. Think about tunneling wounds and how that lines up with the way AMD with PHMB works. If you picture a long tunneling abscess wound that you can't really see because it's deep in the groin or another cavity underneath the skin, wouldn't it be great if you could go beyond absorbing the exudate and put in a packing strip with AMD? Remember we said AMD with PHMB lyses the bacteria cells in the dressing. Well, most of you know how tunnels are. That drainage is going to come in contact with the dressing simply and mainly because it's tight, confined quarters. You've got the dressing right up against the walls of the tunnel. Then let's think about skin folds. Perlex AMD is a perfect choice for all those weeping areas and skin issues, especially those that plague obese patients. Under the pannus or under the breasts, the axilla and inner thighs. Another suggestion is exit and insertion sites. Those are perfect for an AMD sponge or foam disc. Again, that's right where the drainage is going to come in contact with the dressing. And then there's post-op patients. With surgical site infections on everyone's mind, from the surgical team to the patients themselves, why not elevate your facility's best practice and make changes to place an AMD dressing on every post-op patient or those who aren't getting negative pressure or some other specialty dressing? And this is where my mind really starts to churn as a WOCN because I start thinking of so many possibilities with AMD. I think of AMD under the umbrella of infection prevention. So it could and should be used on the front end of infection defense. Again, with silver, as we said before, we often wait until we see signs and symptoms of infection. A couple of reasons: it's so expensive and can have adverse effects. But with AMD, it's really cost-effective and has minimal adverse effects. So let's start asking ourselves, what if? What if we could optimize the use of AMD to target those patient populations who are at high risk for infection? For example, what would happen if we made a protocol for every diabetic wound? Think about amputations alone and patients with high A1C. Elderly patients with such fragile skin, prone to skin breaks and skin tears. And then maybe for every post-op ortho patient or CABG patient who aren't getting a specialty dressing. Lots of times there's areas of exposed bone. Why not give them a good jump out of the gate from surgery? The potential to use it with any ulcer or crater wound is an obvious one, especially if your go-to is a wet to dry dressing. Why not use Kerlix AMD instead of regular roll gauze? Caesarean sections, that's another case for AMD gauze. And then I think about foot and heel wounds that are so susceptible to outside pathogens, and again, many with exposed bone. Then, of course, there's trauma wounds. Oh my gosh, why not make AMD protocol or best practice for at least the first 3 to 4 dressing changes for trauma wounds? You know, with trauma, we have no control of the conditions before the patient arrives, whether it's a car crash on a dirt road or rusty metal piercing the skin. But we do have control of that patient's dressing selection after they come into our care. When you look at the variety that AMD comes in, roll gauze, sponges, foams, foam discs, non-adherent dressings, drain and IV sponges, packing strips, you'll start coming up with your own ideas for raising the bar of quality patient care, which could ultimately be a real difference maker in patient outcomes. And finally, I just want to point out there are several peer-reviewed journal studies, including randomized control trials supporting the efficacy of PHMB as noted on the slide. These studies demonstrated and support what we discussed previously, decrease in infection rates and effectiveness of AMD dressings with significant cost savings. Additionally, another multi-center prospective double-blinded pilot randomized control trial showed lowered pain scores. In a nutshell, AMD with PHMB is proven to be safe, cost-effective, and efficacious in the prevention of infection. With an intense focus on facility-acquired infections such as SSIs and CLABSI, as well as patient satisfaction scores, why not consider adding AMD with PHMB to your toolkit?